Welcome to Ending Chronic Disease, where we challenge everything you thought you knew about health. Join international best-selling author and wellness pioneer, Dr. Fabrizio Mancini, as he reveals how to transform your body, your mind, and your life starting today.
Hi, this is Dr. Fab Mancini, and I'm so excited that you're here with us because today we're going to talk about ending chronic disease. But primarily, I want to tackle cardiovascular disease. And I brought one of my favorite doctors in the world, somebody that has mentored me personally, somebody that takes care of millions of people around the world, somebody that's becoming very famous because of his not only education, but his approach towards health, especially as a medical doctor that has expanded his knowledge towards being very effective in functional medicine. So Dr. Michael Turner, it's so great to see you again.
Thank you. It's a pleasure to be here. That's a very kind introduction of you, Fab. And I love what I do. I love to educate and inspire people, to take care of themselves. So I'm looking forward to that today.
Well, let's start a little bit with that journey because I'm sure that as you started your career and you decided that you wanted to be a medical doctor, you went to some of the finest schools out there. Tell me a little bit about what was your driving factor in becoming a doctor in the first place, and how did you get yourself more into the functional space? It's not becoming rapidly increasing within the medical doctor education, and many doctors are now becoming functional medicine doctors to get to the root cause of the problem.
Yeah, phenomenal. Well, I had a strong interest in health that started especially in high school. I took a health class and I started learning about the body and, how the heart works and the lungs and the muscular system, nervous system. It's amazing. It's a wonder, So I was pretty motivated. I started getting rid of some of the candy bars and the chocolate milk at school. I started running, in my neighborhood, and I started lifting some weights downstairs in the garage, tried to get some abs and some biceps and things. So my personal health was starting to really get going. I went through college. Initially, I wasn't interested in medicine. Long story short, I changed after I ended up working at a summer camp for kids with medical problems. This is actually one of the camps started by Paul Newman. So all the Paul Newman's products, this is the original camp that they were set up to fund. So I was there. I saw the doctors. I started thinking about medicine as being for me. And to your question about functional medicine, I guess I didn't carry around that phrase in my mind, but that's essentially what I was doing from that point forward, because I was trying to take great care of myself from a preventative and naturalistic perspective, going to Harvard Medical School, learning all these amazing things about health and wellness and how the body works, going to the Mayo Clinic, learning more things. And so I just carried it along. There's nobody said I can't go to Harvard and also do a yoga class at the end of the day or take some vitamins. So I just started combining the best for myself and then sharing it with others, of course.
Well, that's one of the things that I think is what allows you to be a successful practitioner. It's the fact that you don't look at things from a box perspective. You go outside of the box, and maybe sometimes you even remove the box completely away, because it's what we have to do today in order to be able to solve this chronic disease epidemic. We notice that 90% of the cost of healthcare is chronic disease. And we notice that it's impacting most of our loved ones. And I don't mean just one disease. A lot of people that are struggling now with multiple disease processes all at once and living typically by medication alone, having to take all these medications to get through the day. So let's talk a little bit about, and I know that you are very well known in many different areas, but today I wanted to talk a little bit about cardiovascular. We know that it's still our number one killer. We know that there's a lot of people struggling out there, not really understanding or even thinking what got me here in the first place. They just see them struggling, maybe with a potential high blood pressure, high cholesterol, maybe a stroke that came out of nowhere. It could have been been serious. A little bit about how you have learned to look at the cardiovascular system, and what is it that you think we need to know as patients as to why this system is so critical?
Yeah, absolutely. Well, as you mentioned, it's the number one cause of death and disability between heart attacks and strokes. And if you think about it, not only that, every organ in your body, in order to do its job, it needs enough circulation, right? So poor circulation means all of your organ function drops, including, for example, your brain function. So brain, fog and cognitive impairments and dementia and things. In fact, there's a movement to consider Alzheimer's as atherosclerosis of the brain. Essentially, there's a strong, reason and scientific rationale why that might be so. I just want our people to understand a couple things about your heart. The first one is that it likes to work hard. Okay, it likes to sweat. It likes to exercise. It likes to sit in the sauna and get very hot. Okay, that's fun for it. I want you to think of your heart like a racehorse. Okay, $1 million racehorse in Kentucky. You can't leave it in the barn all day. You have to get it out. You have to run it hard. It likes to run. It needs to run. It's in its nature. That's your heart. Your heart gets stronger if you use it like other muscles. I mean, that's not new news, but it's worth remembering. Also, your blood vessels, you can grow new blood vessels in your heart. So even if you've had a heart attack, you can get new blood vessels, which are essentially natural bypass. So we want to take the heart out of the barn every day. My goal is 30 minutes, let's say, break a sweat. That's the simplest rule of thumb, and make it feel fun. It can be anything. It could be a Zumba class. It could be walk with your wife in the neighborhood, right? It could be chopping wood in the backyard. It could be doing a yoga class, so make it fun. Take your heart out of the barn every day. That's the most important thing, keeping it simple. And the other thing I would say about our heart, what's really important to know is, the basics of how to eat in a healthy way. What you eat can affect your heart and blood vessels literally 20 minutes later, right? There's even a phenomenon of people eating like big, fatty, greasy meals. Imagine like a triple level, hamburger, cheeseburger, and a shake, and then having a heart attack immediately afterwards. That's a known phenomenon. It's been written about in the medical literature because your body trying to deal with that much volume of fat and saturated fat and sugar becomes so inflamed and the lipid levels rise acutely. It's actually a risk factor. So to keep it simple, cardiovascular diet side is minimizing sugar. Sugar is pro-inflammatory, first of all, and inflammation helps drive cardiovascular disease. And number two, minimizing saturated fat. Saturated fat is fatty meat, fatty dairy. Saturated fat's also inflammatory. It raises LDL levels. Now, there's some ongoing debate about how important is LDL, small versus large LDL, and hard plaque versus soft plaque. And some people are saying, saturated fat's not so important. Like, it's up for discussion, but it's definitely not a good thing. It's not doing you any favors. All right. There's nothing that saturated fat does that's great for you. So you want to move to healthier types of fats. So that's the basics. And then, trying to eat more fruits and vegetables. Everybody knows that. It's a little hard to do. My favorite hack is a smoothie. So I tell people, fall in love with making a smoothie. If you can get a NutriBullet, you can throw a bunch of stuff in there, put some stevia or some monk fruit or some cinnamon, make it taste good, put a little whey protein powder, and in 20 seconds you have a salad, and drink that on your way to work. So that's my starter.
Well, I love the way that you make it very practical, and you cover, of course, the importance of exercise and moving our hearts. You cover a little bit about the diet. Let's talk a little bit about supplementation, because, you've been in this space and you feel there are some patients out there that are very heavy into supplementation and they understand the importance of things like CoQ10 and others. But there's others out there that really have no idea of what is the value of supplementation for a healthy heart. What would you say?
It's of tremendous value. I take many supplements every day specifically for my heart. They can make a big difference. I'll just give you a striking example, which is fish oil, aka omega-3 fatty acids. I remember when I was at Harvard, one of my buddies was doing a research project, and he's like, "You won't believe what we're finding out in the lab." This is exactly what he's telling me. And he's like, "I'm taking fish oil every day now. You won't believe what we're seeing in this lab." I'm like, "What? What are you guys doing?" He says, "We take the rats and we tie off their carotid artery, okay, on one side. We're trying to give them a stroke. We're literally creating a full occlusion, complete blockage of the carotid artery. We were trying to give them a stroke. But where the animals are pre-treated with enough omega-3s, they don't get a stroke. They keep functioning just fine. We've tied off one of their arteries, and the animal's walking around running on a wheel like nobody did a thing to it." And so I was like, "Oh my gosh, are you serious?" So anyways, that was the first little inkling. Fast forward, omega-3 fatty acids, amazing for the cardiovascular system. They prevent sudden cardiac death. They lower blood pressure. They reduce inflammation. And they're tremendously good for the brain. They also have anti-cancer properties. So omega-3s are something that every human being should be on, period. Every human being should be on omega-3s and vitamin D and a couple other key supplements. But that's an important one. I'd say another amazing supplement for cardiovascular health is nattokinase. A lot of people haven't heard of that. Nattokinase. Nattokinase is interesting. Comes from Japan. In Japan, they've eaten this fermented soybean product called natto, Natto. And they've claimed that it has health benefits. Turns out that it does. And as we study, the reason is the fermented soybeans contain this enzyme nattokinase. Nattokinase is like cardiovascular, miracle substance, basically, because it does every good thing you would want. So it thins the blood. It also directly dissolves blood clots. Okay, it's actually used as stroke therapy over in Japan. They'll give you an IV of this stuff. It directly dissolves blood clots, reduces blood pressure, and then it changes blood cholesterol levels in 3 healthy ways. So you have 3 numbers that we care about: LDL, HDL, triglycerides. Nattokinase touches all 3 of those. It sends all 3 of those in the right direction, and it's inexpensive and extraordinarily safe. Bonus to all of that, it dissolves the COVID spike protein. Okay, so therefore it prevents COVID infections and it helps treat vaccine injuries and long COVID. So that's a key one.
Well, I love it. Let's talk a little bit about diagnosis, because many times we go to the doctor, we do a blood work, we do maybe a urine. What do you think are the key factors that we should be understanding about our heart health on an ongoing basis? I mean, we have all these gadgets with our phone and watches and many other technology that is coming abroad. Tell me a little bit about what are the key indicators. You hear about heart rate variability, you hear about those kind of things, but what do you think are the numbers that we should know on an ongoing basis to actually make sure that we are in check with how healthy our heart and our cardiovascular system is working?
Yeah, that's a great question. Fantastic. Well, I'll start from the most in-depth and maybe complicated way and work backwards. But there's overachievers out there like myself, and people that we know, Fab. So if you want to really go for it, definitely a fitness watch or a tracker is vital, like an Oura Ring, a Whoop strap, a Fitbit, whatever. Those are amazing. They'll start to give you some data. You talk about heart rate variability. That's helpful. It's helpful to know, your total time spent in motion and, calories burned and, resting heart rate. And it'll even give you an estimate of your VO2 max, which is a very important number. We could come back and talk about that if you want, but it relates to exercise. And that's the most important metric of cardiovascular health, is what is your VO2 max. So a watch will show you most all of that. Therefore, quite helpful. One level below that in terms of technology and such would be a thorough set of labs, including some things you can check at home, like blood sugar and blood pressure, right? You can check those at home. Everybody, doctors been talking about blood pressure since forever. Why is that? Well, it's the number 1 risk factor for having a stroke. Let's just start there. The number 1 thing, if we had to strip everything else out and just say, what's the single biggest contributor to having a stroke? It's high blood pressure. Your blood vessels are delicate. The inner lining of your blood vessels is very thin. Think of it like saran wrap. It's actually 1 cell thick. It's called the endothelium. It's very delicate. It's very thin. It's like saran wrap in there. And some of your key arteries are not that big. So for example, the arteries that feed your heart is a muscle, it squeezes, but it has to have its own blood supply, right? How does it do that? Well, it siphons off some of its own blood, and then when it relaxes like a sponge, it sucks up some of the fresh blood through the little recirculating arteries, right? Well, those arteries are not that big, Fab. As I mentioned in this last event, they're about as big as a headphone jack. So if you plug a headphone jack in your Walkman, from way back when we grew up, then that's the width of your coronary artery, about 2.5 millimeters. It's not huge, right? And so you got to protect that thing if you want to stay alive. So we have cardiovascular health and knowing blood pressure, for example, and knowing blood sugar is something you can do simple at home. But then into testing, the simple test that your PCP would do is typically a fasting cholesterol panel. That's not great. I mean, something's better than nothing, but it's not great. Within that, you'd want to pay attention to HDL, LDL, and triglycerides. Better than that is something called NMR lipoprotein profile. And then also other advanced cardiovascular tests that I do with patients. We don't have to name them all, but things like fasting insulin and homocysteine and high sensitivity CRP, et cetera. So if all you've had is a basic cholesterol panel, I would say there's a whole lot more lab work that needs to get done, and do some research or come find a practitioner. We can organize that for you. The third thing that I'm a big fan of is a coronary artery CT scan. This is an image of the arteries of the heart, right? What if we could take a picture of these little arteries that are recirculating back in the heart? What if we could take a picture of them and then rotate it in 3 dimensions and look at the arteries and see, is there any calcification of those arteries, or are they nice and soft? That's what a coronary artery CT scan does. And that has been shown to predict cardiovascular risk over the next 5, 10, 15 years. It's very well validated. And it's not that expensive. You can get a coronary artery CT scan done for $200, $300 probably. And it takes you all of 5 minutes. You don't have to sit in a big tube like an MRI. It's a big open donut. So I'm a big fan. I get one every couple of years.
Wow, that's amazing, because I think it's important for individuals to understand that they need to be engaged. They need to be aware of what's happening with their bodies. And now we have no excuse. A little bit, we started with the technology that we all use on a daily basis, but we're also seeing in the healthcare space this movement called biohacking, where it's bringing some very fancy technologies into our space, from red light beds to cold plunges to molecular hydrogen, hyperbaric chambers. What would you say, in your opinion, are maybe 2 or 3 of the biohack technologies that you feel have actually helped a lot of people improve their heart and cardiovascular conditions?
I'd say the most important would be a sauna or infrared sauna. That's the most important. Simply getting hot, having a heat stress that makes you sweat is healthy for your cardiovascular system. Remember, it's a racehorse. We're going to take it out of the barn and make it sweat. It likes that. So your heart actually doesn't know the difference if you're sitting in a hot sauna between that and you running outside, and breaking a sweat. It doesn't know the difference. It just knows there's a heat stress and it has to dilate blood vessels and it's going to create sweating, and all that is, very, very healthy. So you can think of sauna as cardiovascular in a box. This is very accessible for people because most people, if you have a gym membership, they're going to have a sauna, right? If you want to go a little bit more advanced and invest in something, there are these garage saunas of different types. There are infrared saunas, which have their own benefit, also very helpful. I have a little zip-up infrared sauna, cost me about $1,200, got it online. It's nice. I sit in a chair, zip the thing up, goes around my neck, and then I sit there and read my Bible or listen to music or something. And so anyways, sauna is probably the most approachable biohacking. Right with that would be like an infrared light bed. Okay. Infrared light bed's not going to make you sweat. You don't get all the cardiovascular benefit in the same way because there's no heat, but infrared light's amazing. It stimulates mitochondrial health. Absolutely. Reduces inflammation in the body, stimulates even mood, and kind of affects you psychologically. So I'm a big fan of like an infrared light box. Again, that's pretty accessible for most people. Those are probably some of my top ones, cold. And I guess cold plunge, it's a little hard to do mentally, and it's hard for patients to really stay with it. So it's not always the first thing I roll out. But yeah, if you want to take a cold shower, at least, for 15, 20 seconds, 30 seconds, if you're, man or woman enough to do it, then that's also helpful.
Well, I love it.
Yeah.
You've been, you done a lot of lecturing and speaking about potentially during the COVID pandemic, but also the long COVID. What some of the things that we need to be aware of when it comes to our heart health, especially once we were exposed to the virus, and maybe some of the people that may be listening potentially got the vaccine based on what we've seen in the science? What is the things that we need to pay attention to, and what should we do about it?
Yeah, well, it's a big deal. The COVID as an infection, or the vaccine even worse, is very hard on the cardiovascular system. This is why we hear about stories like sudden cardiac death. There's even a movie made about it. We hear stories about myocarditis, right? I have patients who call me like, I had these chest pains that started, and I go to the ER and they tell me nothing's wrong and my heart looks fine and I know there's a problem. The answer is there is a problem, but it's what we call a microvascular problem. It's not a macrovascular problem. A macrovascular problem is the traditional arterial sclerosis, hardening of the arteries, calcium, maybe a big blood clot hanging out there. That's stuff they can detect. Microcirculation, you can't visualize in the emergency room. There's no easy, quick test for that. But we know for a fact that COVID, because of the spike protein, keywords, spike protein, right? Let's just think about that. That's the keyword to focus on. That thing promotes blood clots, and it promotes damage to the lining of the blood vessels that's very thin and delicate, as we mentioned. It promotes clotting and clumping of the platelets. So the spike protein gets loose in our bodies and is a disaster for the cardiovascular system, and it starts affecting mostly the small vessels. When they've done the studies in patients with long COVID and they go looking for these little micro vessel problems and small blood clots, everybody has them. It's 100% of the long COVID people have some problem with microclots. So what that means from the treatment side is we need to get rid of the spike protein, we need to dissolve any microclots, and we need to restore the health of the endothelial lining, that little saran wrap delicate lining. We need to calm down inflammation within that. So that has a set of strategies. On the lifestyle side, I'm a big fan of fasting and sauna. Both of those will boost what we call autophagy, AUTOPHAGY. That is a cellular internal reprocessing and recycling and recleansing process. So basically, when you go into a sauna or you're doing intermittent fasting, it kicks in some genes and some activity in your body relating to turnover. That turnover is good because more turnover is going to mean you get rid of the spike protein faster. So that's great. The second thing would be some basic supplements towards thinning your blood and restoring health in the endothelium. Fish oil is a top one. I'm also a big fan of nattokinase, as I mentioned. I'm a big fan of quercetin, also EGCG, which is green tea extract. All those things I just mentioned do a good job of dissolving or binding the spike protein and restoring health to the endothelium. So that's the first place to start. I mean, it also damages our mitochondria, but short way to think about it is when that spike protein gets loose, it's creating havoc in the blood vessels. It's acting like a little splinter. And just like a splinter lands and causes redness and swelling and pain, you have these microscopic splinters in your bloodstream now, including in your heart muscle, worst case scenario, or in your brain, causing inflammation and damage, and we need to clean that up.
What do you think for those viewers and the listeners that are right now watching us and listening to us? What do you think is it that people need to understand about the way that traditionally medical doctors are trained and this functional medicine that has risen so much over the last 30, 35 years? Because I have never seen this as a competition. It's one or the other. I've always seen it as, different ways of thinking, different approaches towards health.
Yes.
What do you think somebody needs to, when it comes to their heart health, where do you see them where traditional medicine can actually be very critical and very necessary? And where do you think that they need to be at least open to listening to a functional medicine practitioner that may have a different perspective and even perhaps solution for them?
Yeah, great. Well, I agree with you. I've always been a big fan of working together with other medical specialties. And, traditional medicine as regards cardiovascular health has some tremendous benefits. It's literally life-saving if you're having chest pain and you go to the ER. I mean, I had a friend of mine who was a pastor. That happened to him a couple of times. They saved his life, right? I mean, it's tremendous. And it's got tremendous value in assessing your heart, the echocardiograms, the EKGs, the coronary artery CT scan, the MRI of the heart that we can do, the lab testing, and we can look for, clots or platelet counts and so many things. So the diagnostic acumen is very strong within traditional medicine. And at the most aggressive life-saving end, it's also very strong in terms of stents and strong medications and bypass surgery, et cetera. But where it's not strong is prevention and like early or moderate disease. And again, I don't see any conflict in that. Cardiologists can't be experts in everything, right? We all have a niche and a focus. So the more aggressive, high-level triage things are handled well over here in traditional medicine. On this side, this is where your functional medicine or naturalistic approach needs to really kick in, right? As I said, if all you're doing for your cardiovascular system is seeing your PCP and they just check a regular, fasting cholesterol once a year, that's woefully short, right? So now we're in the realm of prevention and education and health promotion And there's a lot of people over in this space, and there should be this, prevention is better than cure, of course, right? So an ounce of prevention is worth a pound of cure, we say. So let's get over on this side. Let's focus. Let's work together. This side over here, ultimately, is going to involve some behavior change. That's where this is difficult. But yes, if you want to get strong cardiovascular system, you're going to have to do some things differently. There's no way, right? Like you're going to have to stop some things and you have to start some things. And there is behavior change. So it takes work, but it gets more into psychology and, behavior change, habits, things like that.
Well, I'm glad that you ended it with that, because to me, I boiled down after 38 years being in this industry to realize that as much as I can learn about the health and the human body potential of healing, I have no control over what that patient does. The only one that can actually help that patient heal is themselves. So for those of you that are listening, I want you to understand all of this information is geared to help you make a better choice. Because at the end of the day, that's what it boils down to. The choices, the little choices, the small choices that we make on a daily basis, they lead to where you end up, not only tomorrow, but next week, next year, 5 years from now, 10 years from now. And what I notice is that the mindset lays tricks on you in which you will talk yourself out of doing something healthy, thinking, oh, it's not going to make that much of a difference if I don't do this now. But you know what? Maybe not as much if you just do it one time. But what if you do it the next day too, and then the next day too? Pretty soon, all of a sudden, you're like, wow, all this extra weight is gone. All of a sudden, I feel like I can breathe harder. I can hike, I can move, I can run. I feel like better than I felt 10 years ago. So these are the things that we are trying to share with you and bring you some of the top experts like Dr. Turner. And the beautiful thing is you can go to his website and have a consult by him. I do that because he's my to-go person. Whenever I have a challenge with one of my patients or something, I know his background is so good that he has found solutions where most people are still struggling. So if you go to michaelturnermd.com, which you'll see it right here next to his name, michaelturnermd.com, you can actually gain a lot of information from his website, but also I encourage you to set up an appointment. Spend some quality time. If you're really right now listening and you're struggling, go ahead and find some potential solutions by somebody that's really been an icon in this space, and I'm just honored to call him a friend. But Michael, thank you again for being with us. And for those of you that are listening, remember, to end chronic disease, you must make a better choice every single day than the one that you made yesterday. If you do that every day, you will be healthy. You will reach your health potential. And more importantly, you will have the life that you seek and that you want, and maybe in my opinion, that you deserve. So God bless you, and I will see you on the next show.
To learn more about Dr. Fabrizio Mancini's groundbreaking work, visit www.endingchronicdisease.com and join the movement. Together, we can end the silent epidemic of chronic disease and create a healthier, more vibrant world. Thank you for tuning in. Until next time, be well and stay inspired.